If my son is exposed to COVID at school or elsewhere after being vaccinated, is he going to have to quarantine?
Sure. So that's an important question because, again, we want to really get um, kids back in school doing the things they love and that they can do. So right now, our current recommendations are that if a child is exposed to COVID-19, whether it's at school or after wherever, after they've been vaccinated, if that child is asymptomatic, which means they don't have any symptoms, they don't have a headache or runny nose or sore throat or any of those symptoms that are on the list of COVID-19, right now they don't have to undergo quarantine. At least that's what our recommendation says. But if they have symptoms, then definitely then they should quarantine if they've got any of those symptoms in that space, because they may not only have COVID, but they might have something else that could be spread to someone else. You mentioned about what about the kids that have immunosuppression or have got some issues? Those kids should not be exposed to whatever the current virus of whatever. So it's a good idea always, if your child's ill, if at all possible, it's a chance for them to stay home from school and get better so they can be back to their best selves. Once, let's say, but back to your original example, if the child has been exposed and they are vaccinated, and some of the older ones, if they've been boosted, they don't have to quarantine. But what you might want to do for these kids is about 5 days after that exposure is to get them tested, to make sure that they are free of COVID. Because what we see is that today is the 25th. So if I'm exposed today, I may or may not show a test positive today, but it might show up if I get infected. If it was able to sneak through those raincoats and those layers and sneak through and I get infected, it might not show up until 3, 4, 5 days later. So that's why we say for those asymptomatic vaccinated kids, you might want to consider getting tested 5 days later. But in that time period, we recommend that they wear a mask when they're around other people and monitor for those symptoms. And again,
Gotcha.
the masking is to help protect against if there's any chance that it got through and that you're not spreading it to someone else. Again, and you may have other cold-like symptoms. That's why the mask is important. So if you've been exposed and you don't have symptoms, you don't have to quarantine, but we recommend that you still wear a mask, a well-fitting mask, and monitor your symptoms for the next 10 days.